interruption. And it's important, though, to be looking at those big three. You have to be thinking kidney, heart, and stroke. The things that you have to do for blood pressure is look at their kidneys. You can do that with blood test and a microalbumin, see if they're spilling protein. If they're spilling protein with like a microalbuminuria, that's a concern if they're not diabetic. And so the second thing is to do an EKG. There's really not anything to do for like a CT scan of the head to see if they have had anything, if they're not thinking bad, like a headache, anything, or confusion. But still, we want to do tests like a EKG, a kidney test, and to see if those are okay. Now, the people will ask two things with controlling of hypertension. One, do the family members have hypertension? It's a common question. Like they come in and say, "Oh, hi Sally," or "Hi Jim. Does your mother or your dad have high blood pressure?" If the parents have it, the genes are strong. The hypertensive genes are very strong. So it's hard to kind of go around that. It's important to understand that. So whether they're overweight or not, the fact that they have that gene, it's a powerful gene. It's hard. That means they're probably going to get a hypertension to stay. Now, the other questions you have to ask if they're overweight, like their BMI is not 30, maybe it's 40, and they don't exercise, getting people to lose weight and exercise is something that would help them a lot. Now, it doesn't mean they're not going to have hypertension down the road, but it certainly will keep it from going higher quicker. And down the road, it gives you a little bit of a cushion, or you won't need as many medicines down the road. But exercise and weight loss, if needed, is very helpful. Now, if they did, what you want to ask is, did you do athletics in high school? Like you run, played football, played basketball. This is whether it's a male or female. Did you play sports like tennis or anything? If they did play sports and were not overweight, then you can go back to that. We'll say, well, try to work hard and get back towards that weight. And if they do, a lot of times people can really stall their hypertension, needing treatment for a while. And that's important to see that. Now, if they never exercise much and they've always been overweight, you still need to work with them on that. Some people will say, well, what about the gastric bypass surgery? They'd certainly help, especially with diabetics. However, it's also a surgery that can have side effects. It's expensive, and sometimes it's hard to get insurance companies to pay for it. But if you can get them to lose on their own exercise and weight loss, that's better than the weight loss surgery. You have to kind of work with patients on that. I'm clearly more of an advocate of helping people to lose weight, like a pound a week. Sometimes people can lose two, but or at least a pound a week if they can, or 2 or 3 pounds a month, and try to get into exercising, doing things. If they can afford it, go to a gym. Okay, so that's start now. Blood pressures, as I said, over 140. Like if it's 142 over maybe 88, you probably don't want to start. You may say, can you go to, you need to go ahead and buy one. They're not that expensive. If they don't have a lot of money, it's about $30 from Walgreens or CVS. They can take them at home, bring them in, compare against yours. Here's the reason. A lot of times at the office, they get this white coat hypertension. They get kind of stressed out. So when you check the blood pressure, it's a little bit higher. But if you check it at home, bring it in, calibrate it against yours, if they're the same, then it's more nervousness being here, because at home, the ones were nice at home because they can just put their arm on the kitchen table, rest for 5 minutes, take a deep breath, and they're nervous when they come into the doctor's office. So you have to keep these things in mind. However, if someone comes in the office, let me go back to that point. You do need to document that you have a bunch of blood pressures below 140 over 90. Not just 142 over 92, but most of the ones at home are less than 140 over 90. And when you bring the blood pressure in, it calibrates with ours at the clinic. Then if it's the same, then it's probably low at home. It's mostly low all the time. Now, if they come in, their blood pressure is 180 over 120, and you take it multiple times, that's a real blood pressure. And a lot of times I'll have them sit there, I'll come back and let them sit there for about 15, 20 minutes, come back and repeat that. But if it's 180 over 120 or even higher, then one, you need an EKG. Second, you need to get those kidney blood tests anyways. And make sure they don't have any chest pain or shortness of breath. Certainly if it's over 200 and they have chest pain or shortness of breath and a blood pressure that high, you need to call EMS. You don't know if they're having an MI. You don't know if they're dissecting their aorta. You don't know what with all that. But if it's way up and they don't have shortness of breath or anything, just give them medicine now. And like you can give them lisinopril and hydrochlorothiazide, and then have them come back within a week with the readings at home and see what it is. But the point is, if it's really getting up there quite high, you do need to start them on a medicine and not wait for time, because you don't know how long it's been high because they've not been taking their blood pressure.